Hey, good morning, and welcome to UroNurse News. I'm your host, Vic Senese. Do me a favor, like and subscribe. Hey, today's story touches a growing and uncomfortable reality in modern medicine. A reality where the more evidence behind a therapy, the less public seem to trust it. A patient recently walked into a clinic visit with the decision already made. She had been on statins for 2 years. Her history was not low risk. Her coronary artery calcium score was 280. Her LDL cholesterol had climbed to 168 after stopping the medication. And her father had died of a heart attack at just 58. When asked why she stopped the statin, she crossed her arms, furrowed her brow, and said she felt foggy, a little achy, and online sources convinced her the statin was to blame. But here's where the story takes a turn. She's not taking nothing. She was injecting a synthetic peptide called BPC 157 3 times a week into her thigh, ordered online, labeled for research only. She learned about it from a podcast, not this one. And when the topic came up in conversation, her posture changed, her arms uncrossed, and her expression lit up. This is not an isolated case. It reflects a pattern many clinicians are now seeing weekly. Patients are increasingly rejecting medications like the statins while embracing compounds with far less clinical evidence. Let's be clear about the science. A major analysis published in The Lancet examined data from nearly 124,000 patients across 19 randomized trials. Out of 66 reported side effects, only a handful were actually supported. No consistent evidence linked statins to memory loss, depressions, or fatigue. Confirmed risks were small, mild muscle symptoms in about 1%, slight increases in liver enzymes, modest rise in blood sugar in at-risk patients. That's it. And by the way, that muscle thing, sometimes taking a different statin can make a difference, as somebody who's done that knows. And the benefits are substantial. Large studies show statins reduce major cardiovascular events by about 25%. And reduce mortality risk significantly with good adherence. A multi-million patient analysis even found that stopping statins can nearly, now you listening, double mortality risk in certain populations. Now compare that to the peptide question. BPC 157 is a synthetic compound derived from a gastric protein. In animal studies, it shows promise in tissue repair. But human data? Extremely limited. A canceled early trial, a handful of small uncontrolled reports, and essentially no robust long-term safety data. No FDA approval, no standardized dosing, no regulatory oversight for most of these online products. And yet, guess what? Usage is increasing. Not because the evidence is stronger, but because perception is. Here's the uncomfortable truth in medicine today. In consumer health culture, trust is no longer proportional to the evidence. Oh, brother. In many cases, it's inverted. So why is this happening? Some patients point to real concerns. Past pharmaceutical scandals, mistrust in institutions, confusing online information. You tune in here so you don't get confused. And these concerns are not imaginary. The response has created a new problem. Patients are now often replacing rigorously tested therapies with biologically plausible but unproven alternatives. And this is where the clinicians feel the tension, because the goal is not control, it's not compliance, it's alignment. The challenge is no longer simply explaining evidence, it is rebuilding how evidence is trusted in the first place. That means conversations like this. I understand why you're concerned about the side effects. I also want you to know what the large-scale data actually shows. And I want us to compare that with what we know and don't know about the alternatives. Because medicine cannot function when perception replaces data, and patients cannot be protected when enthusiasm replaces evidence. Now, what's the drawback? Well, this is a longer conversation with your physician. You don't just trust them, now you have to be a part of that conversation. Doctors have to try to go through and explain. That's probably not a bad thing. I always say, ask your doctor, why should I take this medicine? The future of medicines may not be defined by new drugs alone, but by whether they can reconnect patients to the evidence they've learned to doubt. So, this is UroNurse News. I'm Vic Senese. Thanks for watching. And tonight, Dr. Jeff talks about sex and intimacy. Low desire is the number one sexual complaint among both men and women. Yet it's still one of the least talked about issues in relationships. Why? Because desire often gets wrapped in shame, confusion, and belief that something is wrong with you or your partner. In this episode, Dr. Jeff is joined by leading expert in sexual health, renowned sexologist and researcher, Dr. Susan Kellogg-Spate, for a candid panel discussion on desire discrepancies in relationships. Tomorrow on UroNurse News, we're diving into a medical breakthrough that could reshape how we think about pain control. A new NIH discovery is raising big questions. Could we finally be looking at a powerful pain-relieving drug that avoids the addiction risk tied to traditional opioids? What does this mean for patients dealing with chronic pain, post-surgical recovery, and the future of safer prescribing in urology and beyond? We'll break it all down, what the research actually found, what is still unknown, and why experts are calling this an important step, but not the final answer.
UroNurse News every weekday at 9 a.m. Central Time.